Today we're at St. Joseph's Hospital, and we visited the emergency room to learn about how to treat common emergencies at home before you even got to the hospital. The first demonstration is on basic CPR. We're with Dr. James Pierog. He's the Medical Director of Emergency Services here at St. Joseph's Hospital. We're going to look at some common procedures that can be done during emergencies at home, and the first one is CPR. So Jim, you know, CPR has been frightening to a lot of people. They're afraid to do it because it's been complicated, but things have changed over the past few years. What's the difference now? What's going on?
Well, Larry, as you know, the most important new development in CPR is the fact that only chest compressions are necessary to do now. And it's important that the lay people understand that just starting CPR with chest compressions and not necessarily breathing is an important way to save lives.
Okay, so if I found somebody down on the floor in bed, first thing I'm going to do is shake and shout. Make sure they're really unconscious, not responding. Leave right then and there if I'm alone to go call 911. If there's somebody else there, they can go. When I come back, I'm going to go directly to chest compressions. So between the center of the breasts, right in the middle, I'm going to come down and I'm going to go hard and fast at a rate of about 100 a minute. Important thing is not to stop, or only stop when I can't do it anymore, or the paramedics get there.
So you don't have to stop and do breathing for anymore.
No,
That's
just continue very simply what I'm doing now.
100
okay?
a minute. That's great.
100 a minute.
Remember, basic CPR has been now greatly simplified. You no longer have to do mouth to mouth. All you need to do is 30 chest compressions per minute. And now we're going to learn about what to do when you have a burn, a poisoning, a severed finger or a toe, or a choking problem.
Good morning, Amy.
Good morning.
This is Amy Wanch, Larry. She's
Hi.
our advanced practice nurse in the emergency department.
Amy, thanks for helping us. You know, Jim, choking is a big common emergency. As a matter of fact, in 14 months, my wife did the Heimlich on 3 different people at 3 different restaurants. So if you're sitting at a restaurant near me, you better move because you're going to get the Heimlich. Why don't you tell us about choking? What do you do to take care of the choking victim?
Well, similar to your experience, this is not an uncommon fact. Usually a piece of meat stuck in the upper airway. The victim will give a universal choking sign and be manifested by inability to talk or inability to breathe. And when you see that, your immediate response should be the Heimlich maneuver, which is done by approaching the victim from behind, taking the fist of your dominant hand, in this case the right hand, putting it just above the belly button, and then pulling sharply and firmly toward the victim's back. This should be done in 5 sequences of 5, rapidly and forcefully, to force the foreign body, the foreign object, the piece of meat out of the upper airway.
Okay, and then if they pass out, what do you do then?
Well, if they pass out, you need to lay them down and then begin a CPR like we discussed before with chest compressions.
And then in the meantime, they're calling 911 and helping you out.
Hopefully someone in the restaurant will be doing that.
Okay, great. And then another common thing that happens at home, burns. We all get burned from the stove, or growing up in New York was firecrackers. But when should a person seek treatment? As an Italian, we used to put olive oil on it. Is that still the treatment of choice?
Olive oil goes great with salads and some breads, but it's inappropriate for burns. It has a chance of causing an infection, so you don't want to do that.
Nor butter, right?
Nor butter.
Okay.
What you want to do, though, is cool it with cool water, and that can be placed on a gauze or a towel, a pillowcase, and put on the area that's burned. The minor burns, first-degree burns, which are usually like a sunburn, redness over the extremity, can be taken care of at home. But if it crosses a joint, or if it's on the face, or hands, or feet, or on the groin, those need to be seen in the emergency department or with a care provider.
Okay, so the idea is no olive oil, no butter, cool it. If it's extensive, then get treatment elsewhere. Another thing that happens very commonly are falls, especially with kids, where they bruise their wrist or their ankle, and the first thing that comes up is, do they need an x-ray? Is it broken? What kind of things can you show us on her that would, an examination that a person could do at home to help clarify that?
Well, naturally, if there's a deformity of the extremity, then those would require a visit to the care provider, the emergency department, and x-rays. Also, some subtle findings that may indicate that an x-ray is needed is if there's any pain on range of motion, moving the joint, or twisting the joint. If there's pain localized to the bone, then it would be advisable to get an x-ray at that time.
That's great advice. Another common but gruesome problem is loss of a toe or a finger, usually with chopping or sawing. What should a person do?
Well, this is not an uncommon problem. The microvascular techniques for putting that finger or toe back on now have advanced to the far beyond simply an art, but a science, and there are specialized teams to replant these severed fingers or toes. Assuming that this were a toe, the first thing to do is to stop the bleeding of the proximal part, the part nearest the body. The second thing is to take the finger in this example and wrap it with moistened gauze. It can be tap water, it can be a towel or washcloth, and then place the finger in a Ziploc bag, seal the Ziploc bag, and then place the Ziploc bag on ice. And that's the preferred method of transporting a severed digit to the hospital for an opportunity, potentially, for replantation.
So you want to protect it. You don't want it sitting right on the ice, and that will damage it probably, right?
You don't want to put it directly in water, and you don't want to put it directly on ice because of the tissue damage.
And no olive oil, right?
And no olive oil.
Another problem that we see at home is eye injury. You're working on some wood or whatever, and you get something in your eye. And sometimes it's a minor scratch. Do all of these need some type of treatment in the emergency room? What type of thing what guideline would be that you need to go further?
Well, certainly the organic products like wood products or non-metallic products potentially can be managed at home. If the pain dissipates over the ensuing hour and the scratch of the eye heals up and the foreign body is no longer there, people can certainly stay at home. If it's a metallic foreign body, such as striking a nail, we call it metal on metal, and you have eye pain, then those, for a variety of reasons, should be seen in the emergency department for either an ultrasound or plain x-ray.
Now, poisoning, more common with kids, I guess, but not all the time. What should you do if you suspect that your child or anybody else has taken something poisonous?
Well, the first thing to do, if the victim is stable, and by that I mean is not seizing, is not having breathing difficulties, is not mentally altered. If those don't exist and the victim is stable, then the first thing to do would be to call the California Poison Control Center. And that number is 1-800-222-1222. Very easy number to remember.
I guess the question that always comes up, should you make them vomit right away? Should you, I remember years ago we used to give them Ipecac, and I don't know if that's still the
That used to be the routine for your first pediatric visit with the pediatrician, would be to get Ipecac as a prescription. That no longer is indicated. We no longer have the patients vomit in the pre-hospital setting. So that's relatively contraindicated now.
And lastly, what about head injuries? I know it's a complex topic, but just if your kid hits his head and wakes up right away, what should you do? Do they come to the emergency room, or only if there's vomiting, or what was a brief guideline that you would say?
I think this is a very difficult topic. It's very difficult for care providers, and let's assume that it's a relatively minor head injury, whether or not to come to the emergency department or secondarily to get a CT scan. The most important thing as far as we're concerned is if the parent or family member is concerned about the patient, they should be brought to the department for evaluation, or certainly call your physician. Once they get to the department, then it becomes a professional decision whether or not that patient requires a head CT scan.
Jim, Amy, thanks for coming today. It was fantastic. We learned a lot.